from Canada, from our platform of Voice of Canada. Your host Asphandiar Wadiwalla, my female co-host is Cindy Young, and we have a dynamic guest from Delhi today, a couple who are dentists. They are Aisha Gadodia and Dr. Harman Ghuman. Welcome to our show. Please introduce yourself with your first and the last name.
This is Dr. Aisha Gadodia. I have completed my BDS in the year 2012. And after that, I have practiced in several areas of Delhi only. And I now ask Dr. Harman.
Yeah, now let Dr. Harman introduce himself.
Hi, sir. I'm Dr. Harman. I was born and brought up in Delhi. And since last 36 years, I have been in Delhi and practicing in various corporate dental chains, hospitals, and now currently.
Thank you. Go ahead.
Both of us.
I'm Cindy Young, and I'm your co-host for this evening's show of Voice of Canada, and a very special welcome to both of you on our show today. My question is for Dr. Aisha and Dr. Harman, so if both of you could individually inform us and our viewers about your background in Delhi.
I was born and brought up in Delhi only, and I have practiced in Old Delhi, the heart of Delhi, and also in one of the corporate chains in Delhi. And from there, I gained a lot of experience in my clinical excellence. And then I opened our own clinic, and now we are practicing in our own practice.
My question goes to Dr. Aisha. Inform our viewers of Voice of Canada, when did you finish your dentist degree?
So I completed my graduation in the year 2012 from B.R. Ambedkar University in Agra, and then I practiced in few of the clinics in Delhi only, and then I pursued my master's in healthcare IT. And since my passion was in clinical only, so I moved back to my clinical practice later on.
Now Dr. Harman will reply the same question. From where he completed his dentistry degree and all.
Sure. So I happen to be the batchmate of Dr. Aisha. So we are from the same university, that is Dr. Bhimrao.
Very good.
Agra, and then since 2012, it's been a decade now practicing, and I also started from a very small clinic which is located in East Delhi. Started from there, and now it's been decades. So I've been in the field of dental industry for like last 12 years.
Okay, go ahead with your question.
So the next question, once again, for both of you. After graduating as dentists, if you can inform us and our viewers about your initial experience.
One after the other.
One after the other, yes.
Sure. So initially, when I came out of the dental school, I started working with a clinic which was located around 20 kilometers from my original home, native place, from my home. So I used to go there, and actually that area, it was in a very by-lanes of East Delhi. That area had the kind of audience they had who were not very aware of the dental technology, and because the dental awareness was too low. So I started working there. And slowly, I shifted to corporate dental hospital chains, and the experience, was good enough that I can now easily tackle, patients from any section of the society.
Thank you. My question goes to Dr. Aisha. According to your bio, you entered the dental school in 2006. But to increase your expertise, you did your master in healthcare. Can you explain why you did another degree in healthcare?
Sir, it was basically at that time, it was one of the booming branch in healthcare. That was healthcare ID. Since we are merging our medical fields to technology, so that's why it was important at that time to enter healthcare IT field. But since my passion was always clinical practice, so I entered back to my clinical practice.
Go ahead.
So this question is for Dr. Harman. From your brief bio, we read that you started your career by marketing healthcare branded products. When did you take your dentistry degree, and how did you gain your initial experience?
So initially, as I told you, I did my graduation in 2012. And as I started working in various dental clinics, I realized the need of having a little bit of more knowledge about managing a dental clinic and how you have to market that clinic. So that was the need that I thought that I should go into, learn the marketing strategies of how healthcare brand should market itself. So there I realized the need of, learning this skill, and I did my MBA in hospital management, and from there I gained little knowledge about marketing, about healthcare practices and the healthcare brands.
Nice.
My question is for Dr. Aisha. You both started your own dental clinic under the title of Kanyon Dental Clinic. Please tell us from its humble start, from day one, when you opened the Kanyon Dental Clinic.
Right, sir. So I'd like to answer that question if you
No
don't
problem.
mind.
Go ahead.
Yeah, so actually, it happened in a jiffy actually, and it was the humble background is that's why we say it is a humble background because it was started from a very small space with single chair clinic in a Gurdwara. It was a charitable dental clinic, and it was started in a Gurdwara, so very small space we got, and we actually got the confidence of running a dental clinic from that place. So that was the initial time when we actually came to know the responsibilities that come with the dental clinic. So it was in 2021, 15th October.
But that was the peak period of COVID, 2021.
Fortunately, sir, in India, it was not the peak at that time. A lot of things had opened up, and but yes, there was a little bit of challenge. But reaching out to the community through community outreach programs and educating the masses that how important is oral health during COVID helped us, and that really actually helped us, and we got the initial push to continue that you have that witness luck. So it was through these programs, we got the confidence that yes, we got a good start.
So you did talk a little bit about starting your clinic as that single chair clinic. So how did you go about, for like both of you can give a little bit into this, for you both individuals, so the individual patients. So maybe you can inform us just how you really started to build it to
from a single chair to a multi chairs.
Yes, sir. It was really a difficult journey for us. But yes, we grow. We have grown our practice, and we have grown learning with the experience itself. We started with single chair at a small setup, and then with time, we installed few new equipments. Currently, we have a scanner at our own clinic. We have laser equipment, and we have microscope. So coming up with the new equipments, we need a setup also where we can cater all the facilities, where we can deliver a good service to the patients. Also, when we are serving with a good equipment, it is necessary to have a six-handed dental practice. So we had to appoint assistants also according to that. So that is why we had to broaden our area of practice. So eventually we started with one chair, and then we got another chair second, and then now we have a clinic with 3 chairs currently fully operational with all the assistants working for us.
Nice.
So who does the hygiene work? Because here in Canada, dental doctors, they only perform the surgeries or the dental work, but the cleaning and hygiene work is done by the hygienist. So that is the same system in India?
So not exactly, but in India, I would say there is a fortunate, I would say, for the patient that doctor is the only one who performs all the procedures, and there is another helping hand is the dental assistant. So from cleaning and maintaining the hygiene, and from the restorative perspective till surgery, everything is performed by the dentist itself.
Do your dental clinic provides the dental surgeries also?
Yes, sir, of course, and also maintaining a hygiene of we get our instruments sterilized in case of we have a spill management training for the assistants also, and we have maintained a spill maintenance kit also in the clinic, maintaining all the hygiene for a surgery point of view.
So at your Kanyon Dental Clinic, you have the most modern dental equipment in each room. You practice. You also have appointed individually dental assistants as well to assist you while you're giving a treatment to each patient. So do you have all of that available to you at all times?
Yeah, she said good. She confirmed to that.
Yeah. See,
So my another question to you is a little bit. We move from the dental clinic. Let us know what creative pursuits are you observe in your life, both of you.
Sir, as a dentist, I would say I love to practice art and craft and handicraft, which eventually helped me since childhood. I was been able to do the painting work, and which eventually helped me in my dentistry. So I love to paint, I love to do craft work, and now.
So as far as pursuing my passion is concerned, I love to do gymming. Like I love to cook as well. So I most of my healthy meals on my own. And apart from that, I do help my colleagues, in dental marketing, and that is my passion. Actually to help others, grow their practice. Because
Definitely.
most of the dentists are only restricted to dental process and dental studies, and they actually have no idea about marketing. So I help them scale. And as far as extracurricular activities are concerned, I help gym and cooking.
Okay, my another question, either one can answer that to keep your teeth and gum healthy, what precautions one should take? What are the precautions?
So according to the Indian tradition, if you know about oil pulling, it is one of the very good procedures to keep your teeth healthy. It's a part of yoga, I guess. It's a part of Indian tradition. If your audience doesn't know about it, they can read more about it. So oil pulling is something that I would recommend along with warm saline. So that's again ancient Indian practice to rinse with lukewarm water with a little bit of a pinch of salt in it. So these are the two ancient methods that I generally recommend to my patients, which are very beneficial for your teeth and gums.
Right. So both of you are dentists. Just inform us that how many rounds, how many appointments a patient should take during 1 year for his hygiene, cleaning of the teeth.
So ideally, at least 2 appointments per year is what is recommended.
Okay, yeah.
So,
Here also 2 to 3 appointments are recommended.
Correct.
We go for quarterly basis.
Yes.
Here in Canada, mostly because we have got a very cold weather and we eat quite a bit of some sweet tooth and chocolates and all that stuff. So we have 3 cleaning in a year, the hygiene cleaning visits.
I wish the Indian patients would, are listening to you and they learn something from you.
Do you all also accept the private health insurance from your patients?
Unfortunately, in India, insurance doesn't cover dental facilities, much of the dental facilities. So it is only the out-of-pocket expenditure for the Indian consumers. So that is what the challenge is, and that's the reason people do neglect their treatment.
That is the major cause over here also. Okay, those who don't have the private health insurance, the dental facilities are very expensive over here.
So, since still in Canada there are people who have dental insurance, but unfortunately in India, dental insurance actually don't cover majority of the dental procedures.
Right.
Right.
Go ahead, Cindy.
Dr. Harman, if you can inform us and our viewers all of the services that you offer your dental patients at your clinic, and if you can just outline all the type of treatments that your clinic does offer.
Yeah, so simply we do everything from basic cleaning and maintaining the hygiene for the patients to advanced surgeries. But there are two different services that I would like to highlight. One is that dental care at home. So this is something new, something that most of the clinics really don't know about it. So we do provide dental care at home with our portable dental chairs and X-rays, and it is exclusively for homebound and elderly patients. And we don't do this services for someone who's like busy because of his office or their business schedule, but we do it for somebody who's homebound, who actually cannot walk or maybe bedridden. So, and the other services, dental tourism, that again is a booming field. These days, a lot of people from the West do visit India because of the cost factor involved. So, these are the services that are provided.
We will be taking a short break and we'll be with you shortly. Welcome back after a short break in our weekly talk show, Voice of Canada. Your host, Asphandiar Wadiwalla, my female co-host, Cindy Young, and our guests are a dentist couple, Dr. Aisha and Dr. Harman from Delhi, India. Welcome back after our short break. So tell us, both of you must be knowing, here in Canada, our dentists are regulated by the Dental Association. Like we have the Ontario Dental Association. So like that, you all have got a Delhi Dental Association?
Yes, sir. We do have an Indian Dental
So
Association.
what are their basic duties, what they do? They fix the prices and what they do?
Right. So they basically, help us, with, they just handhold us during our dental practice. So they don't fix the prices, right? But they do, help us in organizing, continuing medical education lectures and CD. They organize the conferences and, where you can learn about the latest advancements in the field of dentistry. And they do regularly. Do check up actually, I would say that kind of put a quality check on the clinic to regulating the hygiene protocols in the clinic and the guidelines. They ensure that the clinic is following the waste management guidelines and all that stuff. But as far as pricing regulations are concerned, they highly think that.
Excuse me, go ahead.
So this question can be answered by either one of you. And if you can inform us, the word canyon is derived from where? So maybe you'll give us a little bit of history on that. And as we also did see on Google, there are many Kanyon dental clinics in Delhi. So what is your link with them?
Right. So I think I'm the best person to answer this. As I coined the term, named our clinic Kanyon Dental Clinic. The story behind is that I'm sure you'll love to hear that. The story is that both of us were working in a corporate dental chain, and then suddenly we decided to open our own clinics. Canyon basically means a steep valley with a very narrow steps, and that eventually leads to a water body, right? So we knew that we are giving up on our comfortable corporate job, and we are stepping into a place where it is not easy to walk this path. The valley is very steep, and any wrong step can actually lead to a disaster. But if we walk it, carefully and ethically, if we go, we will, end up in a good view. So similar, something very calm and relaxing. So this is what the idea was, that we have to go ethically, very much ethically. We have to grow ethically, and that was the reason to name the clinic Kanyon. And as far as other clinics are concerned, I think you must have seen one in Gurgaon, which is in Haryana state. That is also our clinic. So that we have two branches of Kanyon.
Okay, doctor, both of you are being in the partners in the same clinic. What are your plans for 2024 and 25? Do you have any expansion plans, or do you plan to do or open more clinics in the same name?
So we are already operating 2 clinics right now, one in Delhi and another one in Gurgaon, Haryana. So the Gurgaon clinic is only a single chair clinic. We'll try and expand that clinic. This is the current plan for 2024 to 25. And when we talk about the Delhi clinic, we have already made it a multi-dental chair clinic, and we try and give a good service delivery, since we have installed many more new equipments, and we are planning to keep on updated ourselves with the new equipment.
So how you are going to manage the Haryana clinic, Gurgaon Haryana clinic? That's a bit far off, am I right, from Delhi?
So it's around 20-25 kilometers.
25 kilometers, okay. So one of you can be there at that clinic and one at this clinic. Am I right?
Correct. And
Yes.
you can manage that by appointments as well.
And appointing an associate doctor also, a dentist
Not
also.
really. That's not the plan right now, but maybe, we
In
need
near
one
future,
clinic
yes.
which is more towards only appointment-based clinic, and we will not be accepting walk-in platform.
Recently, we are hearing a new term, dental tourism. So, can you explain what do you mean by dental tourism?
So dental tourism, actually, as you are all aware, that dental services are too expensive in Canada and in the West, Canada, USA. So a lot of people, they travel to India. So it's they kind of enjoy the vacations as well, and they get their dental treatment done. So they explore the new country in the same price that they pay to get their dental treatment done in their country. And on the contrary, when you travel to India, you enjoy also, you explore the new places, and you get the best dental treatment because of the advancements that are happening. So, and still can save money. So, dental tourism means.
So, have you ever compared the prices of dental clinics here in Canada and India? Have you compared? Because
Yes,
here the dental services are very, very costly.
Yes, so most of the times, it is like the difference is huge, something that cannot be compared. So I remember in 2013 when I came to USA for a small duration. So at that time, we were charging about 1,500 rupees for a root canal in India. That was 10-12 years back. And in US, doctors were charging $1,500 for the root canal. So you can imagine how much difference it is.
Because here in Canada, our practice is that each and every small plaza also in the residential areas has got a dental clinic. We have got so many dental clinics, but they are all doing very well.
Yes.
And we go to our own residential dental clinics only for the convenience being near. So is that the same system in India and Delhi?
Sir, in India, in comparison, I think the ratio is not very good currently. The patient and the doctor ratio is still less, and still there are a lot of clinics, and still the ratio is very less.
And that's
So
because of the
you all
population.
must produce more dentists or dental surgeons in India.
Yes, of course, but I think the quality should also be that good.
Maintain,
that
yeah,
we are,
correct.
Yes,
Correct. Go
we
ahead.
should be able to deliver good quality treatment to the patients.
Yeah.
So as time discussing the dental practice at Kanyon Dental has rapidly flown by. It has definitely gone by very quickly. We'll be signing off soon. So therefore, if you could please individually, one by one, state your final comments, suggestions on opening or the dental business, and something about your professional life.
And what is the message you would like to give to Canadians being dentists from India?
I think that Canadians are more into, fast food and, ready to eat food, into that practice of eating a lot of sugary foods, sugary drinks. I think they should avoid that and, shift to something more natural, more organic. And Cindy, if you can come again on your question, I can hear it properly.
Dr. Anisha, would you like to give a final remarks, comments before we sign out?
Yes, my suggestion for the people in Canada is that since we are having the fast food, so your dental hygiene should also be fast, maybe using the rinses that we told you, maybe using the water flossers that we have suggested. And of course, you should maintain whatever quarterly treatments, hygiene treatments you are going through. Please don't miss your appointments, it's very important. And being a practitioner in India, we have grown from a small clinic to a multi-speciality clinic. So it was not an easy journey, but yes, we both of us are enjoying our journey because it is a passion that we wanted to pursue. I am being the clinician and he being the marketing. He manages all the marketing part. So we are enjoying the journey.
Because we have a huge travel between India and Canada. The only Air India flight daily operates with Delhi to Toronto on all 7-day basis. So lots of people are traveling to and from India and Canada. So I hope our Canadians would be watching our show and would be knowing if they need any dental services in Delhi, they may contact you all. So I would request either one of you to state the name of your clinic and your phone number and your address.
Right. So it is Kanyon Dental Clinic, and the phone number is 91-742-849-323. And they can contact us at canyondental@gmail.com.
So at times when people are traveling and they need any dental services, they can contact you in Delhi.
We have, so
Thank you. So with that note, we would be soon signing off from this week's episode with Dr. Aisha and Dr. Harman from Delhi. We are grateful to them because it's nearly, I would say it's maybe 2 o'clock in the morning of Friday. But whereas for us, it's only 5 p.m. of Thursday over here. So take care, keep progressing, and do make plans to come to Canada.
sure. So thank you so much for having us.
Pleasure meeting you.
So with that, we will be soon signing off our show, and we would be seeing you next Saturday with the new guest, same place, same time. Goodbye, good night, God bless Canada, God bless India. Sat Sri Akal.